Today in the news, Texas COVID-19 hospitalizations keep rising and set a one-day high. Texas is set to resume executions after delay due to the pandemic and the City of Dallas's hospital capacity report. Today is June 17th, 2020, and this is Dallas Weekly News. Hello, I'm your host Patrick Washington, and this is Dallas Weekly News. Texas continued an upward trend in hospitalizations of coronavirus patients, setting a new one-day high Monday for the seventh time in 8 days. The trend has local officials in some of the state's largest cities urging residents to be diligent about social distancing and other measures such as wearing masks. Texas health officials reported 2,326 patients hospitalized for COVID-19 and 1,254 new cases, the most ever reported for a Monday, which is typically the lowest day of the week for new virus cases. The actual number of people who have contracted the virus is likely higher because most people have not been tested, and studies suggest people can be infected and not feel sick. For most people, the coronavirus causes mild or moderate symptoms that clear up within weeks. But for others, especially older adults and people with existing health problems, the highly contagious virus can cause severe symptoms and be fatal. The mayors of Austin and Dallas, two cities seeing a strong uptick in cases and hospitalizations, urged diligence of social distancing and use of masks. Hospitalization rate has been noted by Governor Greg Abbott as a key indicator for reopening the state's economy, but Texas has been steadily expanding customer capacity for businesses for weeks, even as the number of new cases and hospitalizations have been steadily rising. For example, restaurants were allowed to increase from 50% to 75% last Thursday. Hospitalization rate has been noted by Abbott as a key indicator for reopening the state economy. Abbott has said Texas has the testing ability and enough hospital beds and ventilators to handle a surge in cases. Dallas County Judge Clay Jenkins called rising hospitalizations a tip of the iceberg indicator of a bigger problem. In Austin, Mayor Steve Adler said businesses should minimize occupancy and use strong enforcement of face masks and social distancing policies. Austin Interim Health Authority Mark Escott said the city had a 90% increase in cases over the last week. Hospitalizations rose by 50% and use of ventilators by 29% compared to the previous week. Adler said the city is seeing its Hispanic and Black communities hit especially hard. A Texas inmate condemned for fatally stabbing an 85-year-old woman more than 2 decades ago was scheduled to die by injection Tuesday as the nation's busiest death penalty state prepared to resume executions following a 4-month delay due to the coronavirus pandemic. Prosecutors said Ruben Gutierrez, age 43, was attempting to steal more than $600,000 that Escolastica Harrison had hidden in her home in Brownsville, located in Texas's southern tip, when he killed her in 1998. Gutierrez's attorneys have asked the U.S. Supreme Court to stop his execution after an appeals court last week overturned a stay. If Gutierrez's execution is carried out, he would be the first inmate in Texas to receive a lethal injection since February 6, and the second U.S. inmate to be put to death since the country began to reopen after the pandemic shutdown. Much of the U.S. after the country began to reopen, Missouri resumed executions in the U.S. on May 19th. In Texas, the number of COVID-19 cases and hospitalizations continues to increase as state officials have said hotspots such as prisons and meatpacking plants have been responsible for the rising numbers. But state prison officials said the safety measures they have put into place, including taking the temperatures of participants and providing them with personal protection equipment, will help executions to go forward. 6 executions scheduled in Texas for earlier this year were postponed by an appeals court or judge because of the outbreak. A 7th was delayed over claims of intellectual disability. Gutierrez's attorneys had also sought a coronavirus-related delay but were turned down Friday by the Texas Court of Criminal Appeals. Also Friday, the 5th U.S. Circuit Court of Appeals overturned a stay in the case tied to Gutierrez's request for DNA testing. He says he could point to the real killer and his claims his religious rights are being violated because the prison system won't allow a chaplain to accompany him in the death chamber. Gutierrez's attorneys on Monday asked the U.S. Supreme Court to halt his execution over religious rights violations. The Texas prison system last year banned clergy from the death chamber following a Supreme Court ruling that halted the execution of another inmate, Patrick Murphy, who had requested a Buddhist advisor be allowed in the chamber. A trial in Houston's federal court on Murphy's case is still pending, and the Texas Catholic Conference of Bishops has filed a brief with the High Court in support of Gutierrez. Gutierrez has long maintained he didn't kill Harrison. His attorneys say there's no physical or forensic evidence connecting him to the killing. Two others were also charged in the case. Authorities said Gutierrez befriended Harrison, a mobile home park manager and retired teacher, so he could rob her. Prosecutors said Harrison had a mistrust of banks and hid her money underneath a false floor in her bedroom closet. Cameron County District Attorney Luis Saenz has called Gutierrez's appeals delay tactics. Prosecutors have said the request for DNA testing is a ruse, and Gutierrez was convicted on various pieces of evidence, including a confession. Gutierrez would be the third inmate put to death this year in Texas and the seventh in the U.S. And now the City of Dallas's hospital capacity report. This has been Dallas Weekly News. I'm your host, Patrick Washington, and for these and more stories you can find on dallasweekly.com. You can also follow us on social media on Facebook, Instagram, YouTube, and Twitter. And of course, as always, please, if you can, stay home, stay safe, and we will see you again tomorrow.